Hello, if you are with me, you can just type and make a comment. I will soon start. You can just drop your comment. Let me see the people that are on the live. Then I will start talking very soon. I'm just waiting for people to join. Then I will start on my topic. So if you are in, just double click. Let's see the people, how many lives, how many people are here, so that I can start the live. I can just start discussing on the topic. Dangers of using multiple NSAIDs. So if you are here, just tap. I'm going to mute it for now. So today I'll be talking about NSAIDs. NSAID is what we refer to as what I mean by NSAID. They are non-steroid, they are anti-inflammatory drugs. There are so many drugs that are classified under this NSAID, things like diclofenac, ibuprofen, naproxen, pyrazicam, and the rest of them. They are NSAID. So why I decided to discuss about this is because of the multiple use. Many people just use it wrongly, either knowingly or unknowingly, because in this part of the world, a lot of things are being abused. especially drug. So people could just walk into the pharmacy, how, especially the patent medical store. Sorry, I had some technical issues, so I have to go. So this NSAID I was talking about, we ask you that, they will just tell you, I want a pain relief. Those ones they mix. But when you look at what they are taking, I just see it as a poison, neither as a medication to treat any pain. Because I was opportune to talk with, in fact, not even opportunity, a woman who used to be my client walked up to me one day and told me that she had pain, so she needed to get some medication. And it was late into the night, so she had to send someone to help her get. Probably they got it, obviously, it was from a patent medical store. So they got the drug. You know, they usually put it in a dispensing envelope. They tell you this is one dose, another dose. So she actually brought it to me so that I will see what she took the previous night because she was in serious pain. Behold, what she was actually holding, it was terrible. And this woman in question has ulcer. So some people get it knowingly or unknowingly. So people think it's when they mix in, when painkillers are being mixed, that is when it works better. It doesn't work like that. Because in that woman's case, what I find, because she actually, she bought, they gave the person she sent two dispensing envelope containing mixtures of medication. In that envelope, I could see ibuprofen. There was a capsule of pyrosicam. The popular brand I know is usually a red capsule. There was a capsule of that. There was diclofenac. There was even ampiclos. I kept on asking, what is the ampiclos in that? The amoxicillin, clavulanic acid, right? No? Ampicillin, cozaslin in that envelope. What is it doing there? There was an ampiclos, there was a multivitamin, almost 5 to 6 medications, all in one envelope for someone that just said she's having pain. And one thing about this is that they don't even care to ask you, are you an ulcer patient? Once you just, I want a painkiller, they will dip their hand in the envelope and in the wherever they kept the envelope and give to you. So why I'm even making this video is that I really want people to get enlightened on what they take. Because some of this medication you may be taking, thinking you are solving an issue, is creating more problem for you. Especially when it comes to this end state of a thing. It creates more problem. I don't know why we in this part of the world just like mixtures of medication, because they come every time. You hear them, you don't have mixtures. Sorry, I'm going to pause, I'm going to put it on, I'm going to make this video now. I want to do something. So sorry, like I was saying, a lot of people, in fact, many people in this part of the world, I don't know if it's ignorance or not being enlightened or not being aware of what they are doing. They just like combination of multiple painkillers, which is actually bad because this thing can even be a poison. The people fail to realize that this combination can have effect in the GIT. What I mean by GIT, that is gastrointestinal tract, that is in the stomach. It could actually have a strong effect there. It could cause bleeding. A lot of people need to know that combination of those NSAIDs, the effect, the effect is going to give outweighs the benefit. If you know what it does in the body, I think you may even know, you may prefer not to take a painkiller. So people should just be aware of the combination they are taking. And painkillers are not what you just take. There should be a need for it. There should always be need for you to take a painkiller before you take such medication. Otherwise, do not take. Because painkiller, in as much as you think you are taking to heal or stop the pain that you are having, you are indirectly killing yourself because if you are not taking it as it's supposed to be, that means you are indirectly killing yourself with the painkiller because it has effect. It causes bleeding in the stomach. People don't even know that it has a very strong effect in the organ like the kidney, even the liver. It can cause a very serious liver injury. So people have to be aware. Do you know most of these painkillers that you will go, especially to, in fact, patent medical store because a standard pharmacy will not cut all these drugs mixed in one envelope and keep. People are not even aware. You don't even ask yourself, this medication they are giving to me in an envelope. I can't even have access to the expiry dates. I don't even know if it's an expired drug that they've dispensed in the envelope and kept there for me to buy. Please, if as you are joining, just double tap, like, leave your comments, please. If you have question, you can as well drop it. I will see it and I will respond to your comment, to your question. So people don't even ask themselves if what they are being given is expired. When the drugs are cut, they remove them from the blisters, from the sachet, put in envelope, set aside. Once you just come, I need a painkiller. Someone will dip hand and give you a painkiller and you collect and drink. Please don't mind the noise from my background, please. And you collect and take without even knowing the safety of the drug. If the drug is still valid to be taken or is expired. So we need to be aware of what we take. We need to be aware of. Hello, I can see you. I can see you, Chinyere. Thank you for joining. I can see you. So we need to be aware of what we take because what we also take could be dangerous. It could act as a poison. So once you want to take a painkiller, make sure you are taking the right painkiller for the right purpose. Don't take, you just walk in. Please, I need a pain. What they even tell me is I need a pain relief. Get someone just asking me yesterday, do I have mixtures of pain relief? Please, let's be aware of what we consume. Let's be aware of what we're taking in the name of we are taking a painkiller. We don't take painkiller because we want to reduce or heal pain or stop the pain or alleviate the pain and you end up killing yourself. Most of these things we take, some are taking overdose. So people don't even know the dosage. You see a very tiny, assume the drug is so small, it's not going to work until you take two. Please, make sure you take any medication according to how it's being prescribed. Forget the size of the drug. Forget the size. The size of a drug does not matter. What matters is the dosage. The prescriber knows what that drug is going to do for you, and the prescriber has prescribed exactly the right dose for you. But you're thinking that this painkiller. Sorry, please, I'll mute this video. Let me pick a call. Sorry. Sorry, I needed to go off. I needed to pick that call. It's very important. Sorry. I was talking about NSAID and use of medication. So when you are being given a medication, especially I'm talking about today about NSAID. NSAID is non-steroidal anti-inflammatory drug. Things like ibuprofen, diclofenac, naproxen, aceclofenac, piroxicam. I won't be calling any brand name. I don't want to call a brand. I'll be using the generic name. So you can just, if you don't know which one is ibuprofen, you can just Google it, the popular brand. They cannot give you, show you the brand, then you'll be aware of which is which. I'll just be using generic. I won't call any company's product name. I won't call a brand name. I'm going to use generic. Please, for those that like taking multiple NSAIDs, it's not good. People abuse it. The effect, the consequences of that is enormous. It could harm the stomach. That is what we call the GIT. It can cause bleeding. That is even why when you go to a standard pharmacy to buy a medication, especially the NSAID, they will ask you, Mohammed, you're asking me, am I a doctor? I'm not a doctor, I'm a pharmacist. Thank you for joining. You can as well support me by liking and subscribing to my channel. I'm not a doctor, I'm a pharmacist. So like I was saying, you don't take, when you go to get your medication, why I'm even emphasizing, because I know in developed countries, everything work accordingly. But in this part of the world where we are, where I am, it's not always like that. You could actually walk into a pharmacy store and request for a pain relief. Yes. So you know what you get. Don't say because Mr. A once used this and it worked and he told me I can use this and this and this and this, and you go and combine it. Please be health conscious. Be aware of what you take, because most times people suffer due to ignorance and due to what they've consumed. Always be aware of what you take when you are taking a medication. I'm emphasizing on combination of these painkillers because that is what is common. It is common. There is no day you stay in a pharmacy outlet where you work as a pharmacist, as a medical health practitioner, people don't walk in to ask you, I want to buy painkiller. And what baffles me most is when you try to make inquiry, do you know some people does not actually know they have ulcer? I will say from, okay, I know it's a problem. It's really a problem. So I can see your comment, Mohammed. It's really a problem. So people don't actually know they have ulcer. I had one morning someone walked up to me. She was complaining that the previous day she was having leg pain. The pain was so severe, so she couldn't bear it. She asked one of her siblings to get her a painkiller. They ended up getting her a painkiller, but where they actually got the painkiller, they never asked. Yes, they never asked, and them themselves did not even know. They just gave them a painkiller. I think either ibuprofen or diclofenac, one of them. This one around is not even multiple, it's just single. They got back, gave to their sister to take. When she took the painkiller, she was not even suffering just from the pain from the leg anymore. She now came down with abdominal pain. She didn't know she had ulcer, because most people, when you ask them, they will tell you, I dey eat. That is what we hear. I dey eat well. Eating is not a guarantee that you will not have ulcer. If you like eat a big bowl of food, it doesn't guarantee you that you're not going to go down with ulcer. So because she's now aware, she was given the NSAID. So it triggered the ulcer pain. That fateful morning where she met me, she was in severe pain. She wasn't even talking. She said, Auntie, at this moment, I no care about the leg pain. I am concerned about my stomach. So be health conscious. If you are not sure if you have ulcer or not, it's better when you get to the pharmacy to seek for a painkiller, tell them the one an ulcer patient can as well take if you are not sure of your health status. And do not be in line, do not be so quick to get multiple painkillers. Don't be part of those people that will tell you, I want that mixture, give me that mixture, whether they put for envelope. That is the language. Don't be so quick to that. It has effect on the kidney. It damages the kidney. It causes serious liver injury. It can cause bleeding in the stomach. It has a lot. Why will you suffer for what you just use your own money to buy what will kill you? It doesn't worth it. It doesn't make sense. Please, You can as well drop question if you like. It doesn't make sense. So let's be conscious of what we do. Avoid the use of multiple NSAID. Some people take it ignorantly, but at least try to spread the news. If it is being recommended to you by a doctor, by healthcare professional, be sure the person is a healthcare professional and is being recommended for a particular use. Most times they will tell people to use, maybe you should take ibuprofen for 3 days. The doctor or your healthcare provider have a reason for that. Let the 3 days be 3 days. Please don't escalate it, don't extend it to 1 week. People abuse painkillers. When you are even given the right medication to take to work for 1 week, people don't take it. Just take what you are supposed to take. If they ask you to take for 3 days, there's a reason for that. You do not take more than the prescribed dosage. Because now people are suffering not just because of maybe the ailment, they are suffering as a result of side effect of overdosage. They are suffering due to the overdosage of drug. Something that is being recommended, please do well to take it as it is, as you were told. Sorry. Just do well to take it there because there are so many consequences. Drug, you see, it cures and as well kills if abused. So if you're not, some pain self, there are some times when you're in pain. Please, when you are in pain, there are some pain that you could actually bear. There are some pain that you can hold. There are some pain that with time is going to relieve you. Do well. Yeah, paracetamol is okay. I won't say paracetamol is not okay. Paracetamol is okay, but it's not an NSAID. Paracetamol is not an NSAID. NSAIDs, like I earlier said, I've said the meaning of NSAID. Sorry, non-steroidal anti-inflammatory drugs. Because these drugs are drugs that also have the ability to reduce inflammation. Inflammation is like when there is swelling, they have the ability to reduce it. They are analgesic too, like paracetamol. Paracetamol is an analgesic, but it's not an NSAID. And we can't say because paracetamol is not an NSAID, you should as well abuse paracetamol. I know of people, I've heard people say, this our paracetamol no dey work, it doesn't work. They will end up taking 4. Lots of things happen. You know, when you are in certain kind of practice, you see some things that are overwhelming that you don't even know how to. No, Mohammed is not non-steroidal anti-inflammatory drugs. NSAID, that is NSAID. Then those ones are in capital, then the S is in small letter. No, it doesn't really cause addiction. The ones that cause addiction are those, there are other kind of analgesic. I am not going into that now. Those ones like the opioid analgesic, those ones could actually cause addiction. Somebody, it's just overusage that make people feel if they don't take the pain relief. I know of someone that if the person, I think it's a mindset thing. The person believes that if she doesn't take pain relief, that paracetamol addiction. I've not heard of paracetamol addiction, but anyway, it's good you dropped it here. And you're just pushing me. I'm going to make more research on paracetamol addiction. I haven't heard of it, but thank you for that. I've taken note of that, so I'm going to make more research on paracetamol addiction and actually see that. And you are saying especially people with headache. Mohammed, people with headache, some people need to actually find out what is the cause of their headache. That is the issue. People have headache. At times it could be stress. When the stress becomes too much, the tendency of you coming down with headache is there. Sometimes it's the kind of lifestyle. If some people that have, yeah, people, how? Please, Chinyere, just, I don't know what you mean by how. Can you explain what you mean by how? Can you explain? Please, can you just give me few seconds? Let me pick a call. It's very important. I'll just mute the live now, but I'll mute it when I'm done. Okay, Mohammed, I'm seeing your contribution. Some people's headache, like you said, they say cluster headache, that is migraine. But you know, ideally, we don't use paracetamol for migraine. So stress can cause headache. Lack of sleep, when you don't sleep well, it can cause headache. Some people, because of the nature, I don't know, either your nature of work or your kind of lifestyle could stress you out that your time of sleeping is being limited. And I'm telling you because when it happened to me, when I don't have a good night rest, it's not how you say people that drink alcohol go with hangover. When I don't have a good night rest, I come down with headache the next day. And that next day, I will just be managing that headache and be walking until when I go back home at the end of the day, I will now sleep well. Cause I will now sleep well. If I sleep well the next day, waking up the third day, I am sound. So people just have to look, manage. Not all headache need paracetamol. That is what I'm even trying to say. Some headache need adequate rest and taking enough water. There are so many things that could be resolved naturally without even medication. Yes, people should actually just take a look at the kind of lifestyle, manage your stress, your daily activity. Some people are burnt out with work, but at times I advise people to just make like a plan for the day. Yes, now there is stress-induced headache. Mommy, there is stress-induced headache. Some people have headache due to stress. There is stress-induced headache. It's there. But that one you just said, paracetamol addiction, I'm taking note of it. I think I will have to make a proper research on that because I've not heard of paracetamol addiction. Let me not say I've not heard of it, but I will make research on that. So when people manage their stress well, I think those kind of headache will be relieved. Stress-induced headache will have to stop. Sleep well. People don't know the benefit of sleep. When you get adequate sleep, you will see that a lot of health issues will even be resolved. Most of us, some of the things we pass through are stress-induced. True. I'm telling you because sometimes I'm actually stressed. When I'm stressed, my head, as if the forehead, I can't even look into my phone. That is the height of the stress. Then some are migraine, like you said, migraine headache. There's no amount of paracetamol. If you like, open a whole blisters of paracetamol and drink. It doesn't stop migraine. That is just it. Oh, Mohammed, I don't think I saw this your last. Let me see if I can use my other phone. Like, I don't think I saw your last comments. I'm coming. So please, let's be aware of what we are taking. Let's be aware of what we are taking. Let's not abuse the medication, especially NSAIDs, because we want to take them. They are very dangerous to our health. Please, if you are just joining, please you can support me by subscribing. You should cause it a problem. I treated my family. Doesn't do anything. Mohammed, I don't understand your last comment. I don't understand. You say you treated your family, doesn't do anything. I don't understand. Please, can you make me understand? Just expatiate on that. Let me get what you're trying to say because I don't understand what the comment you put out there. I don't understand. Just please help me understand. I don't seem to understand. So, okay, you're talking about migraine. Okay, what do you now use in treating it in your family? Because paracetamol doesn't um, handle migraine headache. I hope you know. Paracetamol doesn't handle migraine headache. Is this class of drug, the ergot and the rest? Okay, what happened about that means all of you in your family taking paracetamol? I don't get it. Is it that all of you were addicted to taking paracetamol? How did you people get into that addiction? Is it that every day Is it every day you wake up, you take paracetamol? Let me get it. Because paracetamol, you see, it has a dangerous effect on the liver when being abused. It has effect on the liver. Is it that you wake up each morning, you take paracetamol, or when you are going to bed, you take paracetamol? Or is it that I really want to know how you got addicted to the paracetamol. Your parents, or you started it from a childhood. Okay, Okay, you said it's two separate topics. Maybe next time we talk about paracetamol addiction. Then if you join my life, they will get to know how you got addicted because it's something actually worth researching. I think I need to find out how the paracetamol addiction work. So like those that are just joining us, you can just double tap, like, leave your comment. I'm talking about NSAIDs, use of multiple NSAIDs, the consequences of using multiple NSAIDs. Someone just joined now. I just noticed it. Please still wait to leave your comment. If you are just joining, you can also support me by subscribing, leave your comment, we keep growing. So like I was saying, if you are giving NSAID, yeah, people take it for rheumatoid, yes. People can actually use it if it relieves them their pain. But you know the rheumatoid they're talking about, that is what we call rheumatoid arthritis. It's still inflammation. It's still inflammation. So I don't know. I thought if that paracetamol will actually reduce that inflammation to just ease the pain a little. So if many people, what you see many people do, they are just self-medicating. Many people just do self-medication. They will hear somebody will just walk up to you and say, this is what I took. And that is why it subsided. This is what I took, and that is what is. I can say you Chinyere. Hey, Pastor Mo is not food though. He just talked about the addiction. Anyway, I'm just hearing it. Okay, thank God. I'm glad you said you're a Dr. Mohammed. Thank God for joining me. I'm glad. I'm glad you are part of this. At least I've learned something new, so I'll go and make my research further on the paracetamol addiction. Thank God you joined, so I really need to make the research. Someone just asked, is paracetamol food that people will be addicted to it? There's addiction to everything. Don't you know a lot of us now are addicted to phone? People are get addicted to so many things. Anything can be your own addiction. People get addicted to so many things. So maybe that paracetamol addiction is still there. I'm not doubting him, because if people can get addicted to their phone, what is it that somebody cannot get addicted to? People get addicted to a certain kind of food that if they don't even eat that food, they don't get to be satisfied. So anything can be an addiction to somebody. So like I was saying, it's nice seeing all of you. Thank you for joining this live. So let's just be health conscious, create the awareness as much as you can. Don't take. Yes, Chinyere, you say you don't like taking drugs. I don't like taking drugs either. But there are people that without drug, they don't stay. Each day in their life, they must take at least paracetamol. Each day in their life. That is how people even abuse us this steroid like prednisolone. There are people that they will tell you that if they don't take it, that pain will not go. But I think our psychology too also plays a role in it. Let's not believe, just like why I call psychology is that I know people that will tell you that they went to the hospital, they didn't meet the doctor they met on seats was not the doctor that attended to them. Previously, is not their favorite doctor. So whatever medication any doctor on seat gives to them seem not to be working. Yeah, Mommy, thank you. I will definitely do. I will do the research. I will research it. You've given me an assignment and I'm going to do that. I'll research on the paracetamol addiction. Maybe my subsequent life, I'll bring it up. Thank you for that. Thank you for contributing to my life. Thank you for being here. So like I was saying, I can't even remember what I was saying before. I was talking about people that their psychology also plays a trick on them. They will think that if they don't take the medication, they won't get well. Just like going to hospital, if you don't meet Dr. A that attend to you and you are attended to by Dr. B, there are people like that every medication given to them by Dr. B, you can't say a word. They will tell you that doctor does not know what he's doing, it's not working. That is the psychology, and probably it's the same medication exactly. Maybe the doctor just flipped over the file and saw if the people that they refill prescription like BP patients and saw this is what the person is on and still wrote that medication because it's not Dr. A that gave the person the medication. The person will say it's not working. So it's psychology. So some people's psychology make them believe that if they don't take a particular. Wow, that is good. Neuroscience. Thank you. That is good. I appreciate everything you do. Thank you for joining me. At least you made me. I'm going to brainstorm. I'm going to read more. I'm going to make research. I appreciate that. I don't take your comment. I don't take your contribution for granted. I'm glad you joined. At least there's something. I had a glitch in network. I just went out of the live stream now. Sorry. So, Mohammed, I'm very grateful. I don't take your contribution for granted. I'm happy you joined. Chinyere, I can see you. I thank you for joining my live stream. At least, I think I've made an impact in this. And you've also made an impact in the live stream by letting me know about the addiction. So, people, you need to be aware of what you take. If you're an ulcer patient, please avoid the NSAID. It could trigger the ulcer. And even if you're not an ulcer patient, please avoid multiple NSAIDs. It's dangerous for your health. Wow, thank you. You said I have a good spirit. Thank you for that. I appreciate. Thank you. Thank you. Thank you. So, if you have ulcer, avoid NSAID. Like I said, it can trigger, not it could, it will trigger the ulcer pain. Then for those that go to patent medical store seeking for mixtures of um, painkillers, do you have a painkiller, do you have mixtures, please do avoid that. It's very harmful for your health. The liver, the kidney, the stomach. If all these three organs are affected, now that is that. Sorry. But it's true. If, for instance, these three organs are affected, what is the person living for again? The stomach is affected, you're having maybe intestinal bleeding because it will, maybe too much of it could perforate the intestine. You'll be having bleeding, that is in the GIT. You'll be having kidney damage. You'll be having serious injury in the liver. What else are you living for? Which organ will be for? Which organ will you now use like to detoxify, to do other things in the body? Please, let's do it to avoid. Ignorance is really playing tricks on people. We have a lot of, I have a lot of browser stuff. Sorry, Mohammed, I don't get the last this thing you dropped. We have a lot of words. Yeah. This omeprazole issue, I think is another topic for another day. The rate at which people call me, a lot of people are having ulcer these days. I don't know if it's the kind of food we eat, if it's just the kind of food we eat, or the medication they take. There is no day you will not see someone with complaining with symptom of ulcer. So I don't know if it's the kind of medication they take or the kind of food. Because I even start researching on the ulcer, but I have not concluded my research on that. I had to start researching on that. But we don't know, what if the person, it protects the stomach? I know it protects the stomach, but if you are saying this now, don't you think people will now go ahead and buy omeprazole and start abusing NSAIDs? No. Yes, I know it protects, but most times when people are being recommended that, when people are being given that omeprazole, I've seen a prescription like that. I think the person, I can't remember the procedure, what the person did in the hospital, but the prescription came in with omeprazole. I actually asked the person, but the person does not have ulcer. But I reasoned it. I felt because of the NSAID that was in the prescription, the doctor added the omeprazole to protect the stomach from ulcer. So now, if you advise that, you see that with the part of the world where I am practicing right now, anything that is voiced out, people abuse it. You now see people coming to ask you for that and ask you for NSAID. That is it. It will become an abuse again. The next thing, they may even start having addiction. Because people get addicted to everything. So I really think people should just practically avoid NSAID mixture, and they should only take painkillers when there is need for it, and for the duration of time. Sorry, for the duration of time. Painkillers should only be taken when there is need. There are some pain that can actually resolve on its own. There are some pain that is not so excruciating that you can actually bear. It's not all pain that you should take a painkiller. There are sometimes when I have a headache, I don't rush to take paracetamol. I'm telling you, yes, I'm a health practitioner, but I don't rush to take paracetamol because I'll first of all think of what and what have done. It's not always um, a paracetamol issue. Like I said, if you study your body well, when you are down with a health condition, you will know. If you are down with health condition that is that paracetamol, you will know. But if you study your body, if it is stress, like I earlier said, then yes, I'm saying it. It's say morphine is better off a short time. It's not an over-the-counter medication. So I'm actually talking about the over-the-counter medication people abuse. That one you just typed in now. People will abuse it. It will lead to drug addiction and drug misuse. I don't want to be mentioning the name. It will lead to drug addiction and drug misuse. People, these days, there are a lot of things people abuse. There are a lot. So it's even paining me when you see people. There are a lot of things I won't say because I'm on live. There are a lot of medication people abuse. So people should just be health conscious. Know when to manage a pain with medication and know when it just needs a massage. There are some pain that just need massage, gentle massage, and it will be all right. Then when the need for medication comes in, you take the medication, and please do well to take your medication exactly the dose that you've been asked to take, and for the duration of time. Please do not abuse medication. When you get to know the implications of medication abuse, I'm telling you, you will run for your dear life. Maybe when you see medication next time, you don't want to take medicine. If they are giving you even common paracetamol, you think it's common to take, you run away. So please, let's do well to take medications at the right dose, at the right duration of time, and do well to avoid multiple NSAIDs. I know why I am saying this. I know why I just took up this topic today to talk on it, because in my course of practice, there is no day, except that day I did not work. There is no day I will not be in the pharmacy and you will be asked for mixtures of drug. My own concern is this mixtures of drug. I've seen a case. I don't know if people have joined this life when I mentioned. There was an elderly woman. There was about 3 years ago or so. The woman should be clocking her 80s now. She came in with an envelope, dispensing envelope with mixtures of drugs. She now told me that, my daughter, you are not around. That day was on a Sunday, either on a Sunday or in the night. But you were not around. So I was in pain. I asked the person staying with me to help me get this medication. They gave him 2 envelopes, as in each envelope is a dose, according to her, is a dose. So she took one envelope. She actually brought the other one for me to check. I said it earlier. In that envelope was contained diclofenac, ibuprofen. I could see Painkillers, that is ampicillin, clozapine. I saw a multivitamin. I saw a red capsule that I suspect should be pyroxicam. And this elderly woman in question, she has ulcer because she's my client, so she's an ulcer patient. I just told her she should just discard those things. I advised her to discard it. So imagine someone that bought a pain medication to ease the pain and it's causing, and you are adding more problem to the person. Even with, and most of them don't ask. They won't ask you. The patent medical store won't ask you. Yes, if you have ulcer. Yeah, I'm saying what you said, but it was for kidney stone. If it were for kidney stone, but the woman does not have that condition now. She doesn't. What she just have is a pain, and she's an ulcer patient. So what will you do in that condition? She doesn't have. She didn't tell them she was having a stone, kidney stone. She only complained of pain. Probably, I think her legs were paining her. So I can't remember the exact pain, but not kidney stone. But she's having ulcer. So in that case, what do you want her to do? She should take it because she's suffering from maybe leg pain or hand pain or body pain. No, now. Because when you check the consequences of those things, any medication that the risk outweighs the benefit, it doesn't make sense. To me, it doesn't make sense. So it shouldn't be taken. If the risk of a medication outweighs the benefit, I advise you not to take. Even doctors in the hospital, when there is a severe case, they weigh. They need to weigh to know what to do. They will take the safest precaution. For ulcer, you cannot be using Mohammed, I don't know. For ulcer, you say for ulcer. The woman is not using it for kidney stone. No. She just complained of pain and she has ulcer. And I'm sure the person, because I remember that the person living with her is even a teenager. The boy is a little boy, a teenager. So I'm sure the boy will not even tell them anything and they won't even ask. What I'm saying is that I know the location where I practice. I know what could possibly come out of there. So I know. That is why I'm saying what I'm saying. They will not ask her or ask him. So please, let's do well to always be health conscious, know what we take the right medication at the right time and at the right dosage, because it's going to save us a whole lot. Not just our life, it will help us to live longer. Yes. Yeah, Mohammed, I see it. Yeah, it's good, but you know, people mainly go to the pharmacy store to get medication, and this thing you're calling now is prescription, is POM, prescription only medicine. You can't get it without prescription. So except if the person might have visited the hospital where the doctor will have to write a prescription for the person to get it. Otherwise, most people that visit the pharmacy buy, they just, it's over the counter, they buy, and there are some medication a pharmacist will not dispense. The pharmacy store may not even have it. Even if they have it, the pharmacist or the pharmacy assistant, whoever you meet in the pharmacy, will not dispense, because the person coming is not coming with any prescription. Yes, that is how it is. So the person will not dispense because the person coming does not is not coming with prescription. So that one is just, I know you're telling me yes, we are just going to be aware, but now I'm just talking based on generally what is obtainable, as in when you just walk in, what is obtainable when you just walk into a pharmacy. So it will not be dispensed. But that is the truth now. That is the truth. How people will just walk in. Somebody just walk into a pharmacy, please, they have sleeping drug. As in, this part of our world, we strive to survive. Do you have sleep? I will just tell you, in order not to just prolong the case, no, I don't. Because who actually needs sleeping drug comes from the doctor with a prescription. You will now dispense and document. So, thank you all for joining my life. I truly appreciate. Yes, I'm seeing it. Your sleeping drug. Who wants to dispense the sleeping drug? If you think you are not sleeping, why are you not sleeping? Even you to walk in one sleeping drug. Do you know what they want to do with it? Everything have to come with prescription. We have to save our head. That is how it is. If you think you are as a youth of that, you see someone in 1920 asking you, do you have a sleeping medication? No. If you think you are not sleeping and there is something wrong with you, you go to the hospital. They will actually analyze you and find out what is wrong with you. Then they will give you the medication from there. Or if they don't have it there, they will then give you a prescription to get it. All we ask for, do I know what you want to do with the sleeping medication? Thank you all for joining me in this live. And Chinyere, I can see you. Thank you for joining me. Mohammed, I truly appreciate. Thank you for joining. So I'm just going to be going off very soon. I appreciate everything. You've really engaged my life. In fact, I'm impressed. I appreciate. I thank you. You don't know how happy I am. Because all this while I've not gone live. I've just been trying which day, when will I be chance to go live. I'll just do a silent live stream. But today I just created this time. I said even if it's just 1 hour, I'm going to be live. I'm going to go live. I'm going to talk. Because this particular topic have been bothering me. I actually wanted to make a video about it, but I said maybe if I make the video, when you're making video, the video is too long, people may just get bored. I'll just go live and air my mind and say it how it's doing me and tell people what to do and what not to do. I truly appreciate. Sorry. I truly appreciate those that joined me. I'm not taking your journey for granted. I know what it is to join life. Chinyere and Mohammed, you've been here all through with me for almost how many minutes? I'm not taking it for granted. Thank you. Please forget my background noise, I beg. Any noise you hear from the background, just do as if you did not hear it. Just forget it. Thank you. Thank you. I truly appreciate. So now, I'm going to be calling it the end for today. See you some other time. Thank you. Okay.